I've got apologies from Dr. John Pepper, from Mark Brandreth, from Nikki O'Connor, David Crosby, and substitutions in place of Patricia Davis. I've got Claudette Elliott, who is Local Care Programme Director. Is Claudette in the room or online? Okay, looks like she's one that we're waiting for to join. I also noticed we've got Ben Holland joining us, so I'm not sure whether that means that you're standing in for Dr. Iqbal. Ben, can you just confirm you're standing in for Dr. Iqbal?
Yeah, that's right.
That's fantastic. Thank you very much, Ben. Good to have you with us. And then finally, we have Julie Davis attending for the CCG. Thank you, Julie. Okay, so if we do some brief introductions first. Nicola, you're standing in for Jackie. Okay, that's great. Thanks, Nicola. Got that noted now. Somebody else is trying to join. Is somebody going to manage the people trying to join the? Thank you, Michelle. Save me from trying to multitask and fail. It's just multi-failing, really. It's not multitasking. Okay, so if we do some brief introductions first for the benefit of anybody listening in, I'll start with myself, Councillor Dean Cowell. I'm the Cabinet Member for Adult Social Care, Public Health and Assets on Shropshire Council, and I chair the Shropshire Health and Wellbeing Board. If I go around those in the room first, starting to my left with Val.
Hello, I'm Val Cross. I'm a Health and Wellbeing Officer in Public Health.
Hello, I'm Karen Bradshaw, the Executive Director of Children's Services for Shropshire Council.
Might have to, can somebody have a little fiddle with them? Could it be that microphone interfering with things? It appears to be left on. Do you want to have another go, Nicola? See if that cleared it up. Do we have a spare mic that we can swap for Nicola so that everybody can hear? And third time lucky, Nicola.
I'm Nicola Daniels. I'm from the Voluntary and Community Sector Assembly.
Thank you, Nicola. Heard you loud and clear that time. Okay, Penny.
Penny Basin, Head of Joint Partnerships, which is a CCG and Shropshire Council position.
Excellent, thank you. And if you do need, I can only just about see you, so if you do need to speak, just wave loudly.
Good morning, I'm Claire Parker. I'm Director of Partnerships for Shropshire Health and Wellbeing CCG.
Thank you, Claire. I'm working down the other side, starting with Michelle.
I'm Michelle Dawson. I'm a Committee Officer for Shropshire Council.
Thank you, Michelle. Lynn.
Lynn Crawley, Chief Officer, Health Watch Shropshire.
Good morning, Tanya Miles, Exec Director for Adult Social Care, Public Health and Housing at Shropshire Council.
Julie.
Julie Davis, Director of Performance for Shropshire and Telford and Wrekin CCG.
Rachel.
Rita Robinson, Director of Public Health, Shropshire.
Okay, now if I go down the list on the screen, I'll start with Sarah Kerr, please. You're on mute, Sarah.
Sorry. Sarah Kerr, I'm the Armed Forces Outreach Support Coordinator, standing in for Sean McCarthy today.
That's great, thank you. Welcome, Sarah. Steph Jones, please.
Hello, I'm Stephanie Jones. I am the Public Health Development Officer working on the Healthy Child Programme, and I'm also standing in for Anne-Marie Speak, who is Commissioner for the Healthy Child Programme.
That's great, thank you. Welcome, Steph. Tim Collard.
Just observing really, Dean, but I'm Tim Collard, Interim Assistant Director for Legal and Democratic Services at Shropshire Council.
That's fantastic, thank you, Tim, and welcome. And Yang Shang.
Thank you. I'm Yang. I am a public health registrar in my first year of training. I'm here to shadow Rachel.
Welcome, Yang. Nice to have you with us. And then continuing down the list, Ben, we've already heard from you, but introduce yourself, please.
Good morning, Ben Hollands, Midlands Partnership Foundation Trust. I'm the Health and Wellbeing Strategy Implementation Manager there.
Thank you, Ben. Julia Clark, please.
Good morning, from the top of my head. Thank you very much for inviting me. I'm Julia Clark and I'm the Director of Public Participation at Shrewsbury and Telford Hospital.
Welcome, Julia. Greg Moores, please.
Hi, good morning. I'm Greg Moores, Director of People with Shropshire Community Trust, representing Patricia Davis. Morning.
Thank you, Greg. Welcome. And finally, last but certainly not least, is Stacey Lee Keegan.
Morning, everybody. Stacey Keegan, Interim Chief Executive at the Robert Jones and Agnes Hunt.
Thank you very much, Stacey, and welcome. Okay. Welcome, Cecilia. I don't want to rush you, but you just want to introduce yourself quickly before we move on.
Yes, I'm Councillor Cecilia Mockley, Shropshire Councillor for the Corvedale Division, and I'm the portfolio holder for Communities, Place, Tourism and Transport. I have to look it up from time to time.
Thank you, Cecilia. Okay, so if we move on to disclosable pecuniary interests, does anybody have any disclosable interest on any items on the agenda? I can't see anybody indicating in the room. I can't see any hands up online or any comments in the chat function. Incidentally, if you do want to speak online, please either use the raise hand function if you can, and I will pick you up from the list, or post a comment in the chat box, and I'll do my best not to miss anybody out. But I'm assuming by this that nobody has any disclosable pecuniary minutes, so we will move on. The next item is minutes of the last meeting. Now we're going to defer those minutes of the last meeting because there's still a little bit more work that needs to be done with them. There's nothing controversial in it, but we'll be considering 2 sets of minutes at the next meeting if everybody's okay with that. Okay, that's great, thank you. Right, public question time. Now we have a public question, and how do we do this? Do you read it out, Val?
I think we can read it out. There's not too much text on there.
Okay. So you want me to read it out? Okay, I can read it out. That's fine. No, I don't mind. I'm more than happy to read it out. I just thought people might get a little bit sick of my voice. Okay, this question has been submitted by Sue Gerard, Sue Stewart, and Marilyn Jones. In July, we submitted a question to the Health and Wellbeing Board about our proposals for the future of making it real in the light of the integrated care system. Instead of an answer from the Health and Wellbeing Board, we received a response from Kate Garner outlining Making It Real's recent activity. We have all been actively involved in Making It Real for several years, and it was the recent Making It Real Pause and Reflect meetings that prompted us to contact the Health and Wellbeing Board, as participants have had no information about the expected future role of Making It Real in the ICS. We would be grateful to have the Health and Wellbeing Board's answer to our question. And then there is a response from me as chair of the Health and Wellbeing Board, that a full response was provided to the public question submitted to the July Health and Wellbeing Board in relation to Making It Real. This was provided by the Service Manager for Community Partnerships and Day Opportunities at Shropshire Council. The Health and Wellbeing Board is satisfied that Making It Real is working in a structured and democratic way, and will look forward to receiving updates, including that around the refreshed and revived board and progress being made. These will be scheduled into the Health and Wellbeing Board forward meeting plan. However, we recognise that this may not have answered your question regarding Making It Real's place in the ICS. The system is going through a time of rapid development, and partners are working closely together to ensure that we are making best use of resources, including the time and resource of those who are involved in our partnership boards and engagement activity. The Health and Wellbeing Board endorses the Making It Real Board working closely with Shropshire Integrated Place Partnership. However, more work is needed to determine the best way to do this. On the 16th of September, there is an ICS involvement event open to all. The purpose of this event is to look at making involvement business as usual. The system will use this event as a launchpad for understanding the ways which people would like to be involved and how we can do that systematically and for the benefit of all of our citizens, service users and interested groups. I think that's the only public question we've received. Okay, thank you, Val. Right, in that case then, we shall
send that on to Sue, sending response on to the
of course, yes, we'll be sending the full written answer to the questioners, and we'll be attaching a copy to the minutes.
Yes.
Okay, great, thank you. Okay, so we'll move on to system updates. Now, the first one is from the SHIP, the Shropshire Integrated Place Partnership. So I'll invite Penny Basin to give us a presentation.
Thank you, Chair. I will take the report as read and just highlight a couple of areas. So just as a reminder, the SHIP is the Shropshire Integrated Place Partnership is a partnership of commissioners and providers and members of the public who sit on the board looking at our priorities in the system and ensuring that those priorities and outcomes are delivered at a place level. The key highlights for this report are around the updated priorities, which are based on the ICS, the Integrated Care System priorities, and they're also based on the Health and Wellbeing Board draft priorities, which we'll have at this board later on. And we view these as a work in progress. So we will take the Integrated Place Partnership takes its direction from the Health and Wellbeing Board and also from the ICS. So we work collaboratively to ensure that we are delivering the priorities that are set. So those priorities are in the report, and there has been good progress around linking together work on children and young people, mental health, and working with our primary care directors on the areas that they're particularly interested in, which include dementia, end of life, 111. So there's work going on around that. The report also highlights additional investment that's being brought into the area recently for personalisation. So very briefly, personalisation is the way in which the NHS is capturing that culture change around changing that relationship between people and the services they receive, or that relationship between clinician or professional and the service. So it's around taking a person-centred approach. It's around making sure that people are really part of the decision-making within their care. And so the key areas that we're working on for this year and the additional investment that's been brought in is going to focus on children and young people's mental health. It's focusing on asthma, so making sure there's care and support plans for children and young people who have asthma, and it's also looking at a workforce development plan that focuses on those two key areas, with addition social prescribing and weight management services in the NHS as well. So it covers quite a multitude of things, but we just wanted to highlight to the board that that's really positive that this particular area is able to provide additional investment through NHS England.
Thank you very much, Penny. Okay, so firstly, I'll ask if there are any questions actually on the report before we move on to the recommendations. Are there any questions for Penny on the report? Nicola.
I was really pleased to see in the workforce plan that the voluntary sector was part of the training there, and just wanted to clarify that it would be joint training where possible, where members of all the different sectors are involved in the same training event, because I think that's what we need to create that team approach.
Yeah, I totally agree. So yeah, we're really focusing on there's some key areas around within that personalisation envelope around social prescribing, motivational interviewing, behaviour change, health coaching. And so those training offers are opened up. So we have one at the moment out for all of the voluntary sector, as well as all of social care and all of health, to be able to access that motivational interviewing behaviour change. So yeah, I agree totally. Yeah. Thank you.
Thank you, Nicola. Any other questions for Penny? I can't see anybody indicating online, Is there anybody else in the room? No? Okay, in that case, we will move on to the recommendations if we take them in turn. Firstly, that the Health and Wellbeing Board note the progress of SHIP. I think that that's precisely what we're doing at the moment, unless anybody else has any contrary opinions. No? Okay, and secondly, that Health and Wellbeing Board note the work underway to deliver personalisation and personalised care in Shropshire. Does anybody have any comments on those recommendations before we put them to the vote? No, I can't see anybody indicating online. So of those voting members who are present, can I have a proposer, please, for the... Thank you, Claire. And seconder? Thank you, Tanya. So for the record, please, all those in favour? Thank you very much. That's passed unanimously. Okay, we'll move on now to the ICS update. And Julie, I believe you're presenting this on behalf of Nikki O'Connor.
Thank you very much. And I'll be bringing the slides up onto the screen.
Oh, sorry, I didn't realise it was a presentation. I thought that was for the report. It's the presentation.
If it's helpful, yeah, it is attached to the as an appendix to the report, so everybody should be able to access it from the agenda.
Obviously, the first slide is basically just reinforcing the 10 pledges that hopefully now are becoming reasonably well known across the system, and also, again, it's to note for the Health and Wellbeing Board the good progress that our system has seen, and not only does the system feel it's progressing well, but that's been reinforced by feedback from the National Board and from the region. We then move on to updates of the various key areas throughout our system at the moment, the first one being urgent care and ambulance, and obviously this is an issue very live at the moment. You'll have noticed, maybe seen in the press, that there's been huge urgent care pressures, and it's not just in Shropshire and Telford and Wrekin. I'm keen to stress we are seeing it across the region. Earlier this week we had something like 8 acute hospitals across the West Midlands, all at the extreme level of escalation. That's clearly to do with we've got some very poorly patients out there. We continue to have significant pressure from COVID and COVID being admissions to hospital, and again at the moment that's slightly over the proportion that we had planned and expected at this time. So again, there's a message out there, please continue to follow good practice, because it's definitely not gone away and it is still continuing to cause pressure. And while we have those pressures, it's undoubtedly going to affect our ability to be able to recover our elective programme, which will come on later. But again, just reinforcing there are those interdependencies because of our limitations of our clinical workforce. Moving on then to the COVID vaccination service. The system again has been an exemplar in this, and our take up across the patch has been excellent. We have also seen now we're getting at almost 90% of our adults over 18 have had at least one dose. 82% of what we're seeing is there is a change across the demographic. So again, another plug, particularly for our 18s to 45, the older population are showing the way on this and are well over the 85% mark. So please, COVID can affect everybody, and also if you there is a note about long COVID, and it is known that if you are vaccinated you halve your risk of long COVID, which can be debilitating for people of any age. So again, we're doing really well. There's still work to be done, and obviously the phase 3 and particularly the announcement of the booster programme on flu is we're still working on that with support obviously from the region and the national team. Moving on then to the hospital transformation programme. As colleagues know, that's also a key priority, as we need to make investment and change the way that we're delivering services if they're to be sustainable, both logistically and from our workforce point of view. And clearly, because of various delays to that, there's work at the moment trying to get and accelerate the transformation, and particularly the community-based models of care that will help support the acute transformation. And also we are trying to get some approval of a business case by the end of this year, so we can try and bring some of that forward, because it's clearly critical to us being able to deliver the care our patients need and keep them safe. Moving on then to Community Diagnostic Hub. Again, that's another area where Shropshire, Telford and Wrekin have been successful in getting one of the regional pilots for this. Again, trying to link this, it's also linked to our work on improving inequalities, and hence the location of that's been selected based on the 10 most deprived areas in England and Wales. We've obviously engagement work is continuing on that, and again, I think that's going to be key. I think one of the things we are all challenged with at the moment is how successful our engagement is being in the current challenges, with a heavy reliance on digital, but also being very reliant of that digital exclusion. And we continue to look for, and again, happy to take suggestions and support for that, because it is really important that we make this work for our patients and public, and that they're really invested in this service and how we set it up and how it provides good and consistent access to diagnostics for people in Shropshire, Telford and Wrekin. Then moving on to mental health. Again, this is another area that we know is one of our local priorities, but is also continually challenged. It's not only physical health demands, increase in demand that we've seen, but massive increase in requests for mental health services, both in adults and then particularly in children and our young people. So we're continuing to maintain the focus on trying to support the crisis and obviously anticipate and support children and young people with that, and the home treatment service. We've also added additional capacity to that children and young people's crisis team because of the increase in demand that we've seen there, with specific focus on eating disorders. We are seeing, again, it's not just in Shropshire, Telford and Wrekin, there's a national increase in children presenting with eating disorders, but clearly we're very interested in our local children and young people and meeting their needs. And again, there's continuing to provide additional support to social care. So again, lots of pressures there, but some good progress and some increase in capacity, and with it being a priority for Health and Wellbeing Board, that's only going to serve us well for the future. Then, as I mentioned earlier, our elective waiting times. Again, Shropshire, Telford and Wrekin is progressing well with its recovery. We're in line with most of our region. We're falling slightly behind on elective surgeries, you'll see here in the key data, and again, part of that is linked to some of our theatre staffing challenges. I'm pleased to say, although that is improving, it's improving slowly. So we're not getting quite the big bang that we'd hoped, but we will start to see improvements in that. And again, we've had to give our hardworking staff their annual leave over the summer, and so I do expect that to improve in September as that leave effect kind of lessens, and also our recruitment and some additional posts start to take effect in October. But bear in mind, all of that will be kind of knocked off course by continued emergency pressures. So that's why that balance around, please, again, encouraging people to only access emergency department when they really need to. Please make good use of NHS 111 where you can, and make sure that that gives you access, because it does have a direct impact on those elective waiting times, and we're all working very hard to improve those for our patients, because we know how frustrating that is for patients. But rest assured, I can also assure the Health and Wellbeing Board our patients are being managed in terms of their clinical urgency, and then that's balanced obviously with the long waits and how that affects their clinical prioritisation, and that's constantly under review. Then moving on, I'm going to ask my colleague Claire Parker, who's the chair of this, to then present on the Health and Wellbeing Hub.
So we've had an engagement launched around the Shrewsbury Health and Wellbeing Hub. We've had over 700 responses. It's been open about 10 days, which is fantastic. This is a really great opportunity to look at developing something that's quite different for the system. It's jointly in partnership between NHS and the council, and also the local community voluntary sector. We've got patients involved at the moment. The engagement process is just to find out what the public want from their health services, so we can do all sorts of different things. It started with issues around our GP practices, around space, thinking about additional roles and multi-professional working within primary care. And we had an opportunity to look at something that was a little bit different. So that's what this listening exercise that's running till towards the end of September. So we just encourage anybody to talk about what they would like to see. What it is not is just moving 8 practices into one. It is about services going forward. So it may not be that 8 practices move at all. So just want to give that assurance. We do want to look and see what is needed, what is wanted, and what makes life easier for the health and wellbeing of our population.
And then finally, moving on to our work with the voluntary sector. There's clearly lots of good work doing there with developing the memorandum of understanding, and we've also, as an ICS, submitted an expression of interest to try and obtain some funding from NHS England's voluntary partnership to support that work. And it's hoped that the MOU will be signed by the leadership and the representatives from the voluntary sector in October, and that I think was also going to be our first public ICS board meeting. So happy to take any questions. Thank you.
Excellent. That's excellent. Thank you very much, Julie. So before I open the floor to questions, just a comment of my own. I'm extremely excited by the Community Diagnostic Hub model and look forward to see it rolling out in a much wider and broader sense. I'm also aware that local MPs raised the affordability gap issue in terms of hospital transformation plan with the Secretary of State for Health and Social Care in Parliament this week. So thank you to them for that. Okay, questions please for Julie or indeed Claire. Rachel.
Thank you for pressing the right button. Thank you. So again, thank you. I've welcomed the format of the report. I thought it was really easy to read actually. So I just wanted to say that and thank you. And again, as Dean said, welcome the work that's happened with the VCS and throughout the report. It's really clear. I just wanted to pick up on the Health and Wellbeing Hub because I think, as Claire said, it's really exciting. I think there's a lot of areas that obviously I would be really keen to link in the GSNA. So some of the information that you're getting through that process that we make sure that we link it through the board. I think there was just a kind of a wider question around you know, whether we look at an impact assessment of that work, particularly around the impact on inequality, think about travel impact, so kind of an integrated impact assessment is just checking, Claire, is something around that going to be done, and can we part and support that? And also I just think perhaps it's something members might be interested in as well, bringing to either a discussion meeting or back to Health and Wellbeing Board, because it's a really exciting piece of work and an opportunity to do things differently.
So yes, is the short answer to that. We have done an equality impact assessment, and as the senior responsible officer for health inequalities from a health perspective, absolutely, the whole reason for doing this is to actually look at the health inequalities population health management agenda, which is why it's quite different, because nobody, the system of building, if you like, wherever it goes or whatever happens, that hub is owned by all of us, so we can do whatever we want with it, which I think is fantastic. We're often restricted by estates and all of those kind of I don't profess to understand it all, even though I work in it quite deeply. But yes, certainly the equality impact assessment is being done. It will go through the project board. Absolutely, I'll link it into the JSNA. I think that's a really good plan. So yeah.
So that answers your question, Rachel.
Yeah, thank you. I mean, I think it's just great to link into that work. I'm thinking of the kind of wider, the travel, all of that, and how we bring it. And I just, and he said it's a really good model for us to learn on. So yeah, just it's making joining that service, which I think we do.
Thank you, Karen.
Yes, so my questions and comments are around mental health. It's really good to see the mental health issue, particularly for children and young people, being recognised, and I know that this board has seen a focus on it. It's really positive to see the investment, but I think it's also important to note that there are still some gaps. Over the last few months, we have been experiencing some really challenging, some really complex children for which there is no ready solution available at the moment. So the first one is that this, and this isn't just about Shropshire, although clearly we are experiencing that in Shropshire. There is a national shortage of Tier 4 beds, and we're seeing an increasing number of children who we believe, and it then becomes a system discussion, require a tier 4 bed. So I guess the question is, what can we do nationally to put some pressure on the system to secure additional tier 4 beds, and should we as a Health and Wellbeing Board be doing something about that within the national system? So that's the first question or point. And then the second one is around the availability of those crisis beds for those children who might be awaiting a tier 4 bed or might be assessed whether they're eligible or require a tier 4 bed. We've been using the Redwoods. It's not necessarily ideal. I know that there's work underway, but I think this board would like to understand where that's up to, and also to keep regular updates on that. That in particular is a key issue for some of our children and families.
I'd like to respond to that, if I may, as the chair of the Partnership Children and Young People's Board. So I absolutely agree with Karen, which she would expect about the pressures that we're under, and I think any pressure that we can put on nationally to increase the number of tier 4 beds for our existing children and our current circumstances is really important. However, I think what we do need to do is look at what the prevention and support model is going forward to stop these children ending up in crisis and needing tier 4 beds. And actually, if we get that support model right and that crisis intervention model right, then children won't need tier 4 beds. So what we should be looking at is a model that children and families are supported, and Karen and I have been having those discussions. And just to give some reassurance, not assurance at this stage, the Children and Young People's Partnership Board is looking at doing, or it starts this week actually, a stock take review of children and young people's services across the system. So we know that we've got gaps, so we need to identify those. We need to be able to prioritise our funding streams as we get them. We need to lobby for more funding for children's services. We need to ensure that actually we support children's services going forward, because that will support all of us through health and social care in the future. And actually those services that we know where we've got best practices to doing well, but are having increased activity and demand, we can do something about also, because we'll know what the projections are over the next 5-10 years, and we know that COVID has had a massive impact on that activity. So those are some of the things that we're looking at through the system work.
Okay, well that sounds, I'll come to you in a second, Lynn. That sounds like there actually are no recommendations attached to the report, but that sounds like that we're possibly moving towards a couple of recommendations there. And one I would suggest would be that we ask for a further report to come back on early intervention work to the Health and Wellbeing Board. And secondly, and the point that both you, Karen, and you, Claire, raised about raising the pressure nationally, I would suggest you could ask me as the chair of the Health and Wellbeing Board to write to our local members of Parliament and ask them to take that up with the Secretary of State. Okay, right, okay. We'll come back to those as recommendations in a minute, but I'll bring in Lynn next, please.
Thank you, Chair. I just wanted to let the board know that Healthwatch Shropshire are working with Healthwatch Telford and Wrekin at the request of SAF to develop a piece of work to reach out to the children and young people using crisis mental health services to get their experiences and also their views of what could be done to improve that experience of waiting potentially for those tier 4 beds, but also try to understand what they think could have helped prevent them reaching that point. And so we've developed a letter to go out directly to those children and young people to say we're here and we want to hear their views. And to support that, we're also doing what we call a hot topic, calling out to and professionals working with those young people to get an understanding of this situation, particularly from that young person's point of view, and also their ideas for potential solutions to this issue. And so we'll be launching that very shortly with a press release. So it might be helpful to speak outside of this meeting with Karen and Claire in a little bit more detail about that piece of work. We're seeing it very much as a first piece of work around this issue to get that perspective from the children themselves.
That's excellent. Thank you, Lynn. And I'm sure that Karen and Claire would be only too happy to take you up on that offer to have a conversation outside of this meeting. Are there any other questions to the report? Tanya?
Thanks, Chair. It's just a comment, I think, on the recommendation under the urgent care and ambulance pressure slide, and recognising the national pressures that we all can read and see, and we are absolutely seeing it here in Shropshire. As we enter into winter, I think Health and Wellbeing Board do need to seek some assurances around that community offer in terms of how we're supporting the population of Shropshire to be well and healthy and to try and avoid going into A&E. So I know there is joint work at the moment between West Midlands Ambulance and community partners looking at that community offer. So I'd like to recommend that we ask a report to come to board in terms of that feedback, please, Chair.
I'm quite happy with that. We can add that as a third recommendation. Value keeping. Excellent. Lynn, you wanted to come in on that point?
Thank you. This was the second point I wanted to raise. So earlier this year, Healthwatch went on to ask people their experiences of accessing urgent care, particularly using NHS 111 first. And we've been asked to repeat that piece of work this winter with a plan to launch that again in October so we can get some direct comparison to our earlier findings, but also hopefully this time promote it as even more widely to as many views as possible about that experience, about what's working and what difference particularly what is making. Thank you.
Thank you, Lynn. Sounds like there's a train passing behind me, blowing a whistle. Okay, I've got Ben Hollands online who wants to come in.
Thank you, Chair. Just a couple of things. Thank you for the report. I think it was really, really useful, easy to read. Just come in to the mental health section, just to note, I suppose, that we do have the transformation programme for community mental health. This does exclude sort of inpatient services and children, but nonetheless, I guess there's something there about making sure all those things connect up, and just want to ensure that that's kind of noted, really. With regard to work around the Health and Wellbeing Hub in Shrewsbury, if there's any insight which could be shared around that, that would be extremely helpful, because there will be sort of public consultations to follow around the transformation programme, and it'd be useful just to have sight of anything which was kind of relevant to mental health from that consultation, so we're not asking the same questions twice.
Julie, is that okay with you? Are you happy with that? Excellent. That sounds like you're onto a winner there, then.
Thank you.
Any other questions before we come to these recommendations? I can't see any hands up either in the room or online, so we'll turn to these three recommendations that we have drafted out. Now, the first one was a request to report back to the board on the early intervention and prevention work in terms of children's mental health. Second one was a report back to the board on winter pressures and the community offer. And the third one was for the board to ask me as chair to write to our MPs to a request that they raise the issue of lack of capacity of tier 4 beds with the Secretary of State.
Yes, and I think Karen and Claire are going to put something together to write the right. I'm just going to review.
Are you going to put the technical stuff together?
You're going to put the request to Dean to write. Yeah.
Okay. Okay. That's very good to hear. Right, okay. Do we have a proposer for those recommendations, please? Kirsty, thank you. And second, Karen, thank you. Any other comments before I move to the vote? No? Okay, in that case, for the record, can I ask all those in favour, please? Excellent, thank you all very much. Okay, we will move next to the Joint Health and Wellbeing Strategy Consultation, and Val's presenting this paper?
Thanks, Chair. Yeah, this paper just briefly describes the consultation and engagement process for the Joint Health and Wellbeing Strategy, which launches today. Just to say that there was a typo in the report referring to an Appendix 1, which doesn't exist. It was just to know that. So the draft strategy consultation starts today, and the online survey goes live. There's one for the public and one for stakeholders, and it's going to be hosted on the Have Your Say portal on the council website. So it runs for 9 weeks, and Shropshire Libraries have provided good support and said that they will help people complete the surveys online in libraries if they need help with that. And we're also going to have large print paper copies and standard font copies of the surveys too, which people can complete and return to library staff. Although the online really is the preferred option, but it's really important that we have that provision in for people who can't use online. In terms of engagement, our partners Health Watch proactively supporting work, and today actually consulting with a sight impaired on sight impaired forum, and we'll also be going to the hearing impaired groups and groups of older people. And again, we've adapted materials, but we've got the large print flyers and large print and paper versions of surveys if they're needed, and they can be completed, like I said, in libraries. Taking part are also helping us out, and they're going to be adapting the engagement questions and engaging with their groups. And we've had positive conversations with Shropshire Youth Association around the engagement questions, and again, talking to Health Watch about that too. So we're making sure that young people are involved in this, as we know, children and young people are a priority, and so it's vitally important that we get the voice of young people too. Partnership boards and committees currently scheduled to talk to are going to the local pharmaceutical committee next week, Early Help Partnership Board, Family Carers Partnership Board, which I think is called the Shropshire Carers Partnership Board, and the VCSA Forum. So the engagement, as I said, we've got, although the survey is 9 weeks, we have got a bit more flexibility in terms of the engagement up to Christmas. So, what I please ask is if board members have got any forums or groups that they could take the engagement questions to. We've got the engagement questions ready. There's a comms and engagement document that's created and will be circulated to the system comms and engagement group, and it has everything that's needed in there. So I'd really, to reiterate, this is a joint health and wellbeing strategy, and as much support needed as possible will be very much appreciated. There's going to be a press release issued today to launch the strategy. And like I said, we're going to be circulating that comms and engagement plan across. So there's things like key messages, the context of what the strategy is, a website text which we would like to go on to all partners' websites, and social media messaging too. And I think that's it. Thank you, Chair. So if anybody's got any questions, very, very happy to take those.
Okay, thank you, Val. Any questions for Val on that paper? I can't see any in the room, and I can't see any online. So turning to the recommendations, there's one recommendation, and that's that the board notes the Communications and Engagement Action Plan, and members commit to supporting this process as equal partners to the success of the Joint Health and Wellbeing Strategy. Does anybody have any comments or anything to say on that as a recommendation? No. Okay, in that case, can I ask for a proposal then, please? Tanya, thank you. Can I ask for a seconder, please? Julie, thank you. And for the record, all those in favour, please? Okay, that's excellent. Thank you very much. We'll move on next to an update on the Joint Strategic Needs Assessment. I'll hand over to Rachel for this.
Thank you. Thank you, Chair. So again, this is just a routine report that we provide to the board just to give an update on progress around the JSNA. The key areas I just wanted to pull out are the SEND JSNA, as a draft report that was seeking through to the relevant boards in August. At the moment, it is due for completion with publication scheduled for October. So that's moved forward. Work around the pharmacy needs assessment, which is obviously a statutory responsibility of this board, is progressing, and a review of the evidence and resources is currently taking place. And that is, just to remind the board, the work will be carried out jointly with Telford and Wrekin, but obviously there'll be 2 separate reports produced, as is the statutory requirement. In terms of the place-based work, there's 2 elements to this. The first is the web-based profiling data that is now being pulled together. That it will probably take until December to be completed and pulled together, but that will be across all 18 areas across the county and start pulling the place-based data together. It won't be just at a place-based level, it'll be at a smaller geography wherever possible. That will be a first stab. It will start to then pull together some of the engagement, the softer data, which is what we're talking about, the information with Claire and obviously Lynn have been highlighting. We'll start to pull that together into one place. We've taken the decision in terms of the 3 areas that we're going to be going out and starting engaging with to write the needs assessment documents, that we'll do that alongside whilst we're waiting for some of the profiling data. We don't want to wait until December until that data is available. We have some information we can start to go and engage with our communities, and the anticipation that that will begin in September and October. The first wave will take longer, I expect, as we learn and work through how we want to make this work with our communities, and it may look different in each community, with a view that we'll publish the first 3 of those reports in March, and then obviously we'll speed up the process as we become as we move through the waves and the other areas. So I think that's in terms of where we are with some of the JSNA needs assessment documents that we're pulling together. Obviously, as part of the JSNA, you'd expect us to continue to monitor data and start to pull together information and key outcomes. Obviously, that will be aligned to the Health and Wellbeing Board strategy. The SHIP work will be starting to pull those together and aligning them. And what is included in the report is information, like, for example, around mortality, which we, just to assure the board that we do monitor these indicators, we'll bring that information through to the board, obviously flag up any particular issues and keep them under review. And obviously all of this links into the system work that we need to do around monitoring inequalities and monitoring performance. So to reassure the board that through that group we're starting to bring that information together. And just to confirm as well, following the meeting we had, the last Health and Wellbeing Board meeting, we picked up conversation with MPFT regarding linking that mental health work together as well. So we're looking at how we can support that programme of work that Julie mentioned in her report, and obviously Ben's mentioned, and we're starting to pull those together. So just to assure the board again that that conversation was picked up. Thank you.
Thank you, Rachel. I know there's been an awful lot of work gone in to get this to this stage at this point in time. So well done to the team for that. Do we have any questions for Rachel? Can't see anything in the room. Can't see anything online. Okay. Right, in that case. Oh, Ben, come on.
Just want to note my thanks, Chair, to Rachel for the support of her and her team in pulling together that needs assessment for the mental health transformation. It's been really supportive, collaborative approach. So thank you, Rachel.
Thank you.
Thank you, Ben. Okay, so looking at the recommendations, we're being asked to note the update and the revised work programme timescales. I don't think that's at all controversial. Can I see a proposer, please? Claire, thank you. And a seconder? Tanya, thank you very much. For the record, please, all those in favour? Excellent, thank you very much. Okay then, so we will move on next to health in all policies. Now we've got Sue joining us online. I'm not sure, has Amanda been able to join us as well, or is it just Sue?
Unfortunately, Amanda is not well today, so it is just.
Well, Sue, I'll hand over to you then, please.
Thank you. We have here a paper on health in all policies. I wondered, Rachel, if you wanted to give a brief introduction, then I can cover the paper.
Thank you, Sue. I think just to note that this paper links back to a previous paper that we took to the board back, I think, in March, although I think the weeks and days and months have all blurred into one, where we talked about that wider input the board The wider programme of work of the board around what we call the wider determinants of health, which are effectively those things such as the economy, education, air quality, transport, that all impact on people's health and well-being. And we brought a paper to the board that talks about the board's response and some of the priorities, and health in all was one key element of this. So it just builds on that report to try and explain what we mean by health in all and how we want to take that wider determinants approach to everything we do, whether it be transport, etc., and how we look at those programmes and make sure that they are helping and supporting us deliver health and wellbeing outcomes. So health in all builds on that, and I'll hand it to Sue to give a bit more information.
Thank you. Yes, building on what Rachel has said, we took a Health in All Policies report to Cabinet way back before the pandemic started last February, and Cabinet have approved a Health in All Policies approach, which I will explain in more detail. The Cabinet approval was in 2020. So this approach to health in all policies that we are proposing builds on the Cabinet approach that we have already had agreed. Health in all policies is a World Health Organization approach to embedding health in all of the policies that we consider. It is similar to a health inequalities approach, where we ensure that health is considered when we are bringing together all papers and all strategies. And in this aspect, we are working jointly with who works in health inequalities. The Health in all policies approach that we are proposing here is that each paper that is brought to the Health and Wellbeing Board is subject to screening to ensure that the I apologise. I have a shared working space, and we're coming to a mutual agreement that we'll have quiet in the background. Thank you. So the health in all policies approach that we are proposing is that all papers that come to Health and Wellbeing Board will be screened for their health input. Clearly, every paper that comes to Health and Wellbeing, we will make this a more formalised approach, where the health impact links very clearly to the wider determinants of health, such as the transport policy, which is a policy that we're working on at the moment across the organisation. We will undertake an assessment. That assessment will then give us the information as to whether we need to undertake a more detailed health impact assessment. That health impact assessment will then inform, in an evidence-based way, the actions that we would propose to embed into the policy, such as the transport policy. So in essence, what we're asking here is that we adopt a formalised way to embed health in all policies across the organisation, but clearly particularly focusing here on Health and Wellbeing Board papers. And I'm happy to take any questions. Thank you.
Thank you very much, Sue. Okay, do we have any questions for Sue on the Health in All? I can't see any hands up in the room or online. Okay, so thank you very much, Sue. Your comprehensive introductions obviously headed off any questions at the pass. I'll turn now to the recommendations and taking them each in turn. There were 3 recommendations for the Health and Wellbeing Board to approve. Firstly, the adoption of the Health in All Policies approach by the Health and Wellbeing Board. How do members feel about that approach? I'm seeing nods and I'm not seeing any shaking of their heads. Rachel.
I think it was just a comment to say, I mean, obviously we are taking this approach, we're doing some work around the system in a similar way, trying to develop a framework, and it links to the, impact assessments, integrated impact assessments. Obviously as a council we've taken this approach, but I think it would be, as a role modelling the Health and Wellbeing Board, it would seem that we should, adopt this approach to the Health and Wellbeing Board and lead the way in both understanding the training, but also making sure that it's clear and so people can understand the process.
Thank you, Rachel. Okay, we'll move on to the second recommendation. The phased rollout approach is taken to implementing this policy. Thoughts? Tanya?
Just a clarification, what do you mean by rollout? And
I'm glad you asked that.
Just so that those of us that are going to be doing papers, we've got really.
I'm glad you asked that, Tanya. Sue?
Yes, yeah. The approach that we're proposing, Tanya, is that we upskill people to undertake the screening process for health impact in a similar way that we've upskilled individuals to do equality impact assessment. So we're proposing a rollout of a training program, which will be coordinated through the usual routes. But for more detailed health impact assessment, then we'll develop the skills within the public health team. But it's an awareness raising and an undertaking of the screening process that we're proposing to roll out. Thank you.
Does that answer your question, Tanya?
I think in part it's just that the next Health and Wellbeing Board, what will be the expectation on board members in terms of putting papers together and just making sure we're really clear about that rollout phased approach. Just yeah.
Okay, so basically, Sue, how quickly is this rolling out, and who will be the first in the firing line that we expect to get this right?
Yes, I mean, the timeline has been really compromised by COVID, not surprisingly. We are working with Tim, I could see Tim was online earlier, to organise an organisational wide rollout. So I would propose that the rollout for Health and Wellbeing Board is aligned with the organisational wide rollout. We don't have a time frame for that at the moment because we're still putting significant effort into the COVID response. But one of Amanda's tasks when she's well and back in work again is to set out the timetable, so I can report the timetable next at the next meeting if that's acceptable.
Yes, thank you, Sue, that's acceptable. I think we just wanted to make sure that nobody was going to be put on the naughty step if they didn't know what they were supposed to be doing. Julie?
It was just to make the link with my colleague Zena Young and the quality director within the CCG. Obviously, we do all the integrated equality impact assessment. So again, there's probably something there that I think we've made some link there. We've got some limited expertise, but it's there, and it seems if we're going to do this as a system, we should make that connection.
Absolutely. So, Sue, can you and Julie pick up the conversation offline, please, to make sure that we've got a common approach across the system?
Absolutely, and we are talking to Lois too, so we'll join you into that. Julie and I will have that conversation.
Thank you. Rachel?
Yeah, it was just to pick up on that, because I think through some of the population health management group, which is part of the ICS work we've been doing, we've been trying to pull together. I think there's a recognition that there's various frameworks, and they all mean they're slightly different parts to those, and there's some overlap and then slight differences. And I think so there has, just to offer reassurance, there has been a conversation about how we start to bring this together, because I know Edna's been involved in some of that work again from the integrated care system. So I think there's a need to try and bring those various work streams, as you said, various levels, you know, lots of expertise across the system, limited resources, but by bringing that together, we'll get more bang for our buck. So it's part of this. I think it's part of that. So I absolutely agree, and we'll make sure we make all those connections.
Okay, thank you, Rachel. I think we've bottomed out what's meant by the phased rollout approach. So then moving on to the third recommendation, that the health and wellbeing in all policies approach is underpinned by a health impact assessment process and is supported with training and awareness raising. Now, is that, forgive me, I may be being a little bit thick on this, is that a health impact assessment for papers that come to the Health and Wellbeing Board, or is that a health impact assessment for any papers within, for example, the council that go to cabinet or scrutiny?
We are looking at the wider approach for cabinets, the papers that go to cabinet and to scrutiny. I would suggest that we, as good practice, also apply it to health and wellbeing board, so organisational wide, but also with a health and wellbeing board focus.
Okay, I understand that now. Okay. Any questions or comments on that third recommendation? Rachel.
I think, yeah, just to clarify, so the cabinet and council have agreed that we'll take that approach within to all papers from the council point of view, and that's the work that Sue's progressing with Tim, and we're going to get written into the board templates for the council, and that's the training that will progress. But we can't do that until we get everybody trained, and that's it happened in, you know, March. I think it was January 2020. So obviously the rest is history around that, and that's been paused. This is the recommendation refers particularly to the board and taking the same approach with the board, I think. So as Sue said, so we want to mirror that and run those parallel. So this recommendation specifically relates to Health and Wellbeing Board and taking this training approach and then this approach with our papers that are brought to Health and Wellbeing Board.
Okay, thank you for clearing that up. February 2020 is an awfully long time ago, or at least it feels like it. And I assume that in this we'll be taking a similar kind of approach to coordinate with Julie and health colleagues as well to ensure a common approach across the system. Yeah, I'm seeing nods. Okay, that's good enough for me. Any other comments or questions on that recommendation? No. Okay, well, I think we've bottomed out what we mean by all of the recommendations. So I will now ask for a proposer. Tanya, thank you very much. And a seconder? Kirsty, thank you very much. And for the record, can I ask for all those in favour, please? That's great, thank you very much. Okay, we'll move on next to item 10, which is the Air Quality Action Plan review. Now, I have a proposal to make from the chair on this, and that is that we defer this report to a future meeting for the reasons that there are some suggested proposals made in the report that we feel actually need further consultation and engagement with stakeholders and with internal colleagues as to how they have a knock-on impact on other plans and policies of the council. And if you're not aware of what I'm talking about, I'm specifically referring to a proposed trial lane closure in Shrewsbury, which I think we need very careful consideration of, particularly alongside transport colleagues and cognizant of the big town plan. And so I think it's right that we take all of that on board first before we ask Health and Wellbeing Board to endorse that as an approach. Is everybody comfortable if we do things that way round? Claire?
certainly would support that. Just thinking of the previous item, it sounds like just the kind of paper where a health impact assessment might be a good trial run.
Absolutely, I couldn't agree more. Does anybody have any comments or questions on that? Cecilia?
Yes, Chairman, I just wanted to say that I think that's a very sensible approach, because I think we need to take a holistic view of this situation, and if we try and do it in bite-sized chunks, and we don't knit it up together, I think we may find that we have gaps and we get ourselves into a situation which we hadn't. So I think this is we need to do a bit more work on this. So I would support it.
Absolutely, thank you. Am I taking that seconding?
Yeah, absolutely.
Thank you. Yes, I can't see any other hands up. Oh, Sue, did you want to come in on this item? Or was it?
Thank you, Dean. Yes, if I could add to that discussion, thank you. In fact, we are in discussion with our transport colleagues around the local transport plan and actually undertaking a health impact assessment for the local transport plan. So I was very pleased to hear our partners suggesting a joined up approach, and I just wanted to highlight that those discussions are ongoing, and thank you for the support.
Excellent. Thank you, Sue. I think that also supports the fact that we need to take time to make sure this is considered from all angles properly and with our partners, including partners that aren't around the table here today, such as the Big Town Plan, Shrewsbury Bid, Shrewsbury Town Council, and the wider public. So if, for the record, can I ask all those in favour of deferral of that paper, please? Okay, that's great. Thank you very much for that. We move on now swiftly to item 11, which is the Children's Speech and Language Update. Now, Steph Jones, I believe you're presenting this in place of Anne-Marie.
Thank you, Chair. Yes, I am. So I would like to provide a summary to this board today to update members on the speech, language and communication work being undertaken in Shropshire currently. So as I imagine some of you will be aware, there was an SEND inspection in January 2021, and from this inspection, significant areas of concern were highlighted, and speech, language and communication was one of them. One of the 6 work streams of action following on from this report is the speech, language and communication work stream for children and young people in Shropshire. And I would like to just briefly highlight some of the elements of the report, which outlines a draft delivery plan, which has been developed by all key stakeholders, including our public health team at Shropshire Council, education colleagues for schools and early years settings, our SEN partners across the system, the Parent Carer Forum, the CCG and Shropshire Community Health Trust colleagues. So the priority of the work stream is to ultimately reduce waiting times for speech and language therapy services. These are currently well exceeding 18 weeks for children waiting for assessment in Shropshire for speech language therapy. So I think that really speaks to the volume of the problem really in that long waiting time for children who may need that intervention. So this is a national concern. Public Health England have highlighted communication as fundamental. It's a fundamental life skill, and there's a need to improve speech, language and communication outcomes for children and young people across England. And this is to ensure that they reach their full potential. In Shropshire, too many children in reception year are not achieving the expected levels of speech, language and communication, with a higher percentage of children and young people falling below the national average. There are many reasons why this might be happening and why children may have delayed development, and some of these are highlighted within the report. However, at Shropshire, we are working on a whole system approach, and we are really taking a focus on prevention and early intervention to try and improve the overall picture. So all members of the work stream have drafted a joint vision statement, and that is to really highlight that speech, language and communication should be everybody's business, and all parts of the system should take responsibility, including parents, carers and educators. The aim of this is to empower all involved in the system to support our children and young people in Shropshire with their speech, language and communication needs, and further to this, to promote that communication is fun and really get those messages across. So in doing so, this should ensure that the right support is given at the right time to the children who need it the most. So the report highlights the drafted delivery plan in which all relevant stakeholders have co-produced and collaborated on this. So it's been recognised within the workstream that there is a lack of joint-up working in relation to speech, language and communication in Shropshire, and this may have resulted in gaps to identification of children with speech, language and communication needs. Further to this, parents and carers face challenges in supporting their child's communication needs, and a focus is required to improve the support provided by early years settings, schools and our public health nursing service. So within the work stream, we're currently working to map out what support systems are available, what are our local offers and what provisions are we providing for speech, language and communication, as well as looking at that wider system approach and what can be done in all areas to really tackle this issue. The work stream have outlined the pathway development, mapping of services, support systems training, joint working, improved communication and innovation as essential to achieving our overall aims. And we really think this will help to transform the speech, language and communication picture in Shropshire. As a work stream, we're working to promote parental involvement, and this is something that we're really keen to develop and really get that parental and carer approach and promote that parents and carers have a role to play in this as well, and especially through our public health nursing service, we really want to encourage that communication element at the earliest stage to try and prevent some children ending up on those long waiting lists. So through improving and achieving our input measures listed in the report, it is hoped that children and young people who require this specialist support, the children who really need it, will receive this at the right time and the system as a whole will improve. The intended impact for this going forward is that the expected levels of speech, language and communication for children and young people in Shropshire will increase by 25% by 2025. So that's our impact that we hope to achieve. So there are lots of elements within the report, and I hope that sort of provides a bit of a summary to some key themes in the report, and just to really emphasise that speech, language and communication should be everyone's priority and everyone's business, and we really hope to embed this in every area of practice to improve outcomes for our children and young people. So I would welcome any questions further to this on the report. Thank you, Chair.
Thank you very much, Steph. Okay, do we have any questions for Steph on the report or presentation? Karen?
Yeah, thank you. I might ramble for a little minute before I get to my question. But first of all, again, this is a really important area, isn't it? And actually, in fairness, was identified by the Children's Trust a number of years ago for those people who've got long organisational memory, including Anne-Marie, by the way. I suppose really just what I'd like to sort of tease out a little bit is the stuff around access to specialist treatment. And I suppose, absolutely, we want children to access specialist treatment when it's required, when it's necessary and when they need it. I suppose my question is around, does this mean, therefore, that less children might be able to access specialist treatment because the onus is being put on more on the early intervention and prevention? And have schools particularly been engaged in that discussion? You did mention that they had, and if so, what what was their views, and what sort of training and development will schools need to provide that early intervention? Does that sort of make sense, Steph?
Yes, it does. So in relation to our education colleagues, they've been really supportive of this work stream actually. We've had some really good engagement, especially from our early years settings, where actually school settings are absolutely essential to the process, but it's our nurseries and early years settings where we can really make a big impact in those early stages and look at those prevention and early intervention techniques. So there is training being accessed by our early years settings currently, and that is continuing. So that is ongoing in terms of assessment for children. There are conversations around increasing provision of training, and that is included in our delivery plan. And whilst this is in its early phases, you know, we hope to take that forward and continue our conversations with our education colleagues as the work stream develops. And yes, the answer is yes. If we can really work to add value and, you know, earlier on in a child's lifetime to the speech, language and communications, and really look at providing early interventions and intervention tools at an early stage, then it inevitably will have a knock-on effect on those huge weights for speech, language and therapy services, and hopefully that children won't need to, and not as many children will need to access those services, which will enable those who do need that specialist support to access it at the right time, because currently we've got a lot of children with very advanced and delayed speech and development on that waiting list who are sat there waiting for support. So we are in conversations at the moment with the speech language therapy services, and they are proposing some changes to their referral process, and they are really encouraging of us as a whole system to engage in intervention before that referral is made. So that is also conversations we are having at the moment as a work stream with the speech language therapy services and education colleagues, and how that may develop and how we will support early years and school settings to really engage in those interventions, and further to that the parents and carers as well, and what responsibilities do they have. And our public health nursing services will continue to support in that and getting across those key messages to parents about communication and what they need to do for their child. So yes, absolutely, you're right in that it will have that knock-on effect and reduce that added extra burden onto speech, language and therapy services, which have been highlighted in the report.
Thank you, Steph. Is that okay, Karen? Thank you. Any other questions for Steph on the report? Nicola.
Can I just ask you, I was quite pleased to see the sort of the importance of parents and carers in sort of developing communication skills, and is part of the programme around investing support in helping parents and carers at the right time to progress to work, you know, to get their kids talking and speaking and actually interacting with them and everything. Is that part of the delivery plan?
Yes, it is. We have outlined that we recognise that is an area that the work stream needs to focus on, and how we engage with parents and how we really get those messages across that communication in those very early days can have a huge impact and really promote that speech, language and communication and help that child develop. So this isn't something new. We've known this for a very long time. It's just really looking at taking that whole system approach and working with our wider stakeholders and partners, because every contact counts, as we know, and it's working with parents and identifying parents and children across the whole of Shropshire. This can include, you know, we've had conversations with our library services, for example, because they run a lot of rhyme time and groups, and we really want to embed this approach across Shropshire in every element of the system. So whilst it is in its early phases in terms of following on from the inspection, these are all elements that we are looking at and trying to develop and look at how we can work with the whole system to promote that parental involvement, because the evidence has been there for a long time that we know that works, and we know it's important. So it's just how we, as a work stream and a wider system, roll that out. And I suppose the report that I've presented today is to raise awareness to this and to ask colleagues to really engage with this, in that speech, language and communication should be everyone's priority.
Thank you, Steph. Is that okay, Nicola?
That's great, but I think that there obviously is a scope for the voluntary community sector to support that with the right input and training and skills. Yeah.
Okay, thank you. Any other questions or comments on the report, please? No, okay, I can't see any. Right, I'll move on to the recommendations. And there's one recommendation that speech, language and communication needs is everyone's business and everyone's responsibility, and a whole system approach to speech, language and communication needs should be a priority. Does anybody have any comments or questions about that as a recommendation? I can't see anybody, so can I ask for a proposer, please? Tanya, thank you. And a seconder? Karen, thank you very much. And for the record, all of those in favour? That's excellent. Thank you very much. Thank you very much, Steph. A fine debut at the Wellbeing Board.
Thank you.
Okay, so we'll move on now to our second debutant of the day at the Health and Wellbeing Board. We have Sarah Kerr presenting an update on the Armed Forces Covenant. Over to you, Sarah.
Thank you, Chair, and good morning, everybody. For those of you who aren't totally au fait with what the Armed Forces Covenant is, I'll just give you a little bit of an overview. It's the nation's pledge to ensure that all service personnel, veterans and their families are treated fairly and not disadvantaged. And as a result of this, it's been identified that in certain areas of public service, delivery of the covenant has proven to be inconsistent, and members of the armed forces community find themselves still facing disadvantage in accessing these vital public services. Through cases brought to the attention of the Ministry of Defence, charities and ombudsman, it appears a lack of awareness of armed forces issue in the decision-making process is a central factor in some incidents of disadvantage. So all NHS trusts and local authorities have been consulted on a draft legislation around the duty. And what we'd like to reiterate is that the rationale for the duty is based on national evidence, not local evidence. There is already a lot of work going on within Shropshire. We are engaging with the GP practices, and since Sean presented at the board in March, we've had 4 GP practices become veterans accredited, which is really good news. We're also continuing to work with the local with SAF and Robert Jones. Again, the veterans champions within both of these establishments have grown, and the referrals are coming through thick and fast, but there is still a lot of work to be done, and we need to make sure that we increase the awareness of the unique obligations facing the armed forces community and understanding of how this can affect their requirements of an ability to access key public services. We need to embed this understanding in the public sector decision making for the policy commissioning and delivery of public services in relation to the armed forces community. Encourage greater consideration for the armed forces community in terms of service provision and where this is appropriate and possible, and increase awareness of other relevant guidance and best practice.
I'm listening into a meeting, listening to a council meeting.
Sorry. So waiting list priority treatment. All veterans are entitled to priority access to NHS care, including hospital, primary or community care, for conditions arising from their time within the armed forces, and clinicians must be aware of this. However, this is always subject to clinical need and does not entitle veterans to jump the queue ahead of somebody with higher clinical need, nor does it enable priority treatment for conditions unrelated to their service in the armed forces. So really, it's just about raising that awareness. Like I say, we are working with the GP surgeries, we're working with the trusts, but it's also all the other agencies that deal with our veteran community, and we're working really hard to make sure that that question is asked: is somebody a veteran? is somebody a spouse or a widower of a veteran? And the group that quite often goes unnoticed are the National Service veterans. We call them the forgotten veterans because they quite often don't identify as being veterans themselves. They just see it that they had to do it. So there's a lot of work going on around that as well. So it's really just to make sure that, you know, we are making sure that the questions and it's being embedded into the services. The legislation has been debated in Parliament. It's due to be presented in the autumn. Once this has happened, it will have a 6-month implementation period, and then obviously it will go on from there. I don't know. I think that, you know, I could go on forever, Dean, but I think obviously you've got the recommendations there. I don't know if anybody's got any questions around those.
Thank you, Sarah. I could listen forever to conversation about the Armed Forces Covenant, because what I've heard and hear from colleagues around the country is that Shropshire is an absolute beacon of good practice for the Armed Forces Covenant, and thank you to you and Sean for all of your hard work in delivering on that, and to our member champions as well, Councillor Nellins and Councillor Hurst-Knight, who's here today, for their support. Are there any questions for Sarah? Cecilia.
It's not really a question, Chairman, thank you. It's more a comment that the Armed Forces Covenant is something that Shropshire Council takes very seriously. And we've been very fortunate in the last council to have had the Karen Core position of the Armed Forces Covenant champion. And we're equally fortunate, I think, this time to have 3 cabinet members actually, who are taking a keen interest in the Armed Forces Covenant, 2 of whom are ex-serving service personnel, and as a result, their connection through to the Armed Forces and the Armed Forces Covenant and the work that they do is very strong. And bearing in mind the fact that Shropshire has such a large representation of armed forces personnel still in the county, I think it's only fitting that that we should take this duty to the armed forces under the covenant very seriously indeed. So I do hope that members will feel able to endorse this report this morning. Thank you.
Thank you, Cecilia. Very well said. Julie.
So I've made the connection because I'm obviously doing a lot of work with the system at the moment as part of the elective recovery programme. And if it's okay, I'll link in with Sarah and make sure that there's a huge amount of, as you can imagine, constant clinical validation of waiting lists, etc. We just need to make sure that we link this in, because we've got an opportunity that probably, you know, it's one of the few positives that may have come out of the pandemic, that we've got a bit of an opportunity to review that and just make sure that those records are appropriately flagged, and we can make sure that, you know, the sort of the policy around how we ensure their treatment, we can, you know, use this as an opportunity just to refresh that. So I'm happy to take that back through my planned care board, if that's okay, Sarah.
That's brilliant, thank you. So one of the issues we've got regarding the GP practices is that the fact that many veterans will have been registered with these practices for a long time and actually have never, you know, I myself am a veteran, and when I moved here 10 years ago, the question wasn't asked at the GP practice, are you a veteran? So it's everything is being done in retrospect, and you know, we've got a lot of elderly veterans around that possibly dementia, Alzheimer's. It's how do we capture those and make sure that they're getting the help and support we need. And I know that the GP practices, certainly the ones that have become accredited, are asking the question, but this is where we need the other organisations like Alzheimer's UK, Age UK, all of the, and the carers groups, all of these organisations to flag it up and make sure that we are recognising our veteran community. You know, a question that I'm asked quite frequently is, how many veterans have we got in Shropshire? We have no idea, but the census that has just happened in 2021 will give us an idea, because the question was asked for the first time. It's never ever been asked previously. So once we get the results of that, at least it will give us an indication as to how many veterans we have got within the community.
Thank you. That's really helpful, Julie, and thank you, Sarah. Claire.
I'm just going to make a comment about primary care because I know Dr. John Pepper would definitely support this because I know he's very, very keen to. We can do some immediate comms. We can work with the accredited practices to start to share that good practice with our other practices. And certainly we can start to get some comms and raise awareness for questions for new patients coming through as a start, and then start working on how do we pick up those that might be missing off the lists. And I'll link into the work with Julie as well about flagging through primary care so that we get it onto the planned care registers. So I'm really keen to support this as well, as I know John would.
Brilliant, thank you.
Thank you. That's music to all of our ears, I think. Any further questions before we move on to the recommendations? I can't see any more hands up online or in the room. So if we turn to the recommendations now, there are three. First one is quite straightforward, that we note the contents of the report. I think we've already discussed that. The second recommendation is note that all GP practices in Shropshire are encouraged to sign up to the Veterans Friendly Accreditation Scheme as set out at paragraph 6.1 and appoint an Armed Forces champion. Now, I rather hopefully assume that that's part of the conversations that Judy and Claire you'll take up with Sarah and then with GP's practices as well. Thank you. I see nods, thank you. And then the third recommendation is to encourage all GP practices and health partners to sign up to the Armed Forces Covenant. Are there any questions or comments on that? Can't see any. Okay, I think to be fair, I think they're all very straightforward as recommendations. So I shall ask for a proposer, please. Kirsty, thank you. And a seconder? Cecilia, thank you very much. For the record, can I ask for all those in favour, please? Excellent, thank you very much. Thank you, Sarah, and for the second time, I'm saying another very fine debut. Thank you.
Thank you.
Chair.
Cecilia.
I did have to go.
Absolutely, no, that's absolutely fine. You did notify me in advance that you had another meeting to go to, so thank you for your time this morning, Cecilia. Okay, I'll move on now to the verbal COVID-19 update provided by Rachel. Just for background to members of the board and those listening in, I have requested, and they insisted, that reports are written and submitted in advance for everybody to read and be able to consider ahead of time, with the exception of the COVID-19 report, because it is such a fluid situation and changing on a daily and hourly basis that I am prepared to extend Rachel a little leeway in updating us on the day.
Thank you very much, Chair. And thank you. And yes, this is a very rapidly changing situation. So just to give you an update, I have put a couple of slides together, which I'm going to try and move and talk. So this is just multitasking. Just so that you can see, because it's difficult to get all of the data when I'm kind of talking through it. I mean, the position in Shropshire has been that particularly over the summer period, we haven't seen cases drop in the way that I suppose we would have hoped to have seen cases drop, but obviously we have had easing of restrictions. And we have seen a levelling off in the last 2 weeks, but prior to that we were actually higher than the West Midlands and the England. So I think it's just to put that in context, and I think Julie's early comments around the pressures that we're seeing across the system. As you can see from the diagram that's been shared on the screen, we have seen COVID come in waves, and we know that therefore we see the waves later in terms of both our hospital admissions and in terms of our deaths. Our current rate is 297 published, but as Carol rightly said, this is a very rapidly moving situation. At that point we were second highest in the region. We're now fifth in the region, as you can see from the slide. However, what I would say is the latest data again unfortunately shows the rise, and we're back to 339. And just to give you an idea of numbers of what that means, earlier in the summer we were around about 160, 180 cases a day testing positive within Shropshire, dropped slightly to 120 cases a day. I've just in the meeting had a line list come through for today, 195 cases. So you can see that unfortunately the pressure is not going away. We do expect numbers to continue to rise now we come out of summer. People are returning to work, schools, colleges, universities are returning, and we've seen that trend in Scotland. So that is kind of gives you an overall picture of where we are. In terms of, see if I can move the presentation on. This is just most up-to-date data. As you can see, it's to show that kind of bouncing around and levelling off. It obviously doesn't include today's cases that are coming on there, but you can see what has happened is it's levelled off, and it's levelled off at a high rate, and it's again starting to climb. That really means that we've got community transmission. COVID is an endemic in our population, and obviously, therefore, that is why we're strongly encouraging and continuing to push messages around both vaccination and, of course, testing to identify people. At the moment, and at future report boards, I do hope to bring information on flu, as I have done in the past. We'll obviously talk about flu uptake, but also on the prevalence of flu in the community. At the moment, we're seeing low levels of infection. I'm just leaving that there because obviously we've got COVID high at the moment. We know we will expect this to increase, and I think, as Julie rightly said, the impact that will then come through later onto our health system and care system is you know, acute, particularly on the pressures on primary care and all of our system who have frankly had a very difficult 18 months. So just final slide. So this, just in terms of outbreaks, I think this just links to my point. You can see our outbreaks are moving up and down. In terms of the number of outbreaks we are seeing an increase, obviously, in outbreaks in care homes, which is obviously concerning. Thankfully, where we've got really high levels of vaccination uptake in our carers and in our residents, so we're not, but we are still seeing outbreaks in those settings. Fortunately, seeing few very poorly individuals, but we're monitoring that situation closely and obviously tightening, making sure we've got all the measures in place. Workforces, schools, workplaces and schools, we do expect to see that those numbers increase. I think just coming to really hospital impact, we did see last week a kind of peak in the numbers of people that were in hospital. It has plateaued at the moment around about 34 beds, but Julie and others have high, again, more up-to-date numbers across the system. But what I will say is this comes in waves, and I'll say that again, and as our numbers start to rise in the community, we will see those going through into hospitals. About half of people aren't vaccinated who are coming into hospitals, but we are still seeing people who are unwell coming into hospitals. Even those who have been vaccinated. And again, that links back to the point around long COVID. As cases increase, we'll expect to see more people with long COVID, and we're learning more and more around this all the time. And we're estimating around 2% of the population that will have long COVID. But you know, again, this will have an impact on particularly on individuals and also on the health system. And then obviously the very sad news is that we continue to see deaths rise in August, and in fact, whilst we hadn't seen deaths for throughout most of the summer, we had started to see a rise. We had 4 deaths last week reported in our hospitals, and we actually had 29 across August and into early September. So again, the news that this is with us. Obviously, positive news, and I won't talk too much about this because Julie's mentioned already around vaccinations. We have got really good uptake of vaccinations across the county. It's been a phenomenal joint effort, but we still do have pockets, particularly in our younger populations, and particularly in areas such as Oswestry, Shrewsbury, and areas of the north that we want to keep pushing that message where we have uptake that's at lower levels. We're doing some great work. We talked about the last Health and Wellbeing Board around, I think it's been named Bob Bus now, but that's our rolling bus that's going around, working with workplaces, going to events. People will have seen the bus working, and I think it actually was a sellout as far as you can sell out vaccination at a balloon festival. We're going to the nightclub this weekend on the 11th, so we'll be outside the Butter Market for those in Shrewsbury, prior to people drinking coffees and having too much fun, but we're just encouraging people. We're going into 6 forms as well, so really just trying to get out and about wherever we can. I think I've had an email in today about other events, so if members have got places that they think we can be, but again, that message is we're just trying to get to people. We use our transport offer where we needed to bring people. We're just working flat out to get people to support people who want and encourage vaccination. And obviously, as I say, I've always pushed testing as well, because if we can identify people can isolate. That obviously minimises the spread and kind of keeping those COVID secure measures in place that are so important. So that is our current position. Unfortunately, at this time of year, we'd like to come out with being able to bring a more positive message. We're not in winter yet, so it's really just reiterating Julie's earlier points. Please, everybody, we just need to continue to remain vigilant. COVID is out there, on top of everything that was coming in winter, so it's really important that we get everybody healthy, well, and I think Tanya alluded to earlier, we really want this wider campaign about keeping people well for winter, not just to get getting your flu vaccinations, which will be coming, getting your boosters when they come, getting your first and second doses, but really getting yourself that campaign on, really keeping everybody fit and well, because that gives the best opportunity. So thank you, Chair.
Thank you, Rachel. Does anybody want to come in on that? Obviously, it's very sad that we're still here, that we're still hearing of deaths on a fairly regular basis in Shropshire. And of course, we send our condolences from the board to all of those who've lost loved ones as a result of this virus. The vaccination uptake is extremely encouraging, and given the large uptake, what was it you said, Julie? 70?
Yeah, I think in terms of single jabs, we are.
I think whilst Julie's looking for the percentage.
Yeah, we've got for adults aged 18 and over, we've got 89.3% have had at least one dose, and just under 82% have had both doses. Problem is we're down to kind of, that drops quite a lot. When you look at the 18 to 24-year-olds, we're kind of 79% and only 77% of the 25 to 29. So is that really that? If we're honest, it's that 18 to probably 45 age range that are still down in some age groups, are in the sort of 60s and 70%, and it really does make a difference. And I sort of, plead to people that to take responsibility for their health and their family members, but it's the impact of long COVID as well. It is incredibly debilitating, and if you can reduce your risk of that by half, then surely that's something you'd want to do, because it isn't I would say this because it's about the pressure on the health service, but it's actually people's quality of life. It absolutely devastates it. It is not a trivial condition, and so I would just encourage people to make use of the vaccination, because it's going to make a difference to your life and that of your friends and family.
Absolutely, Rachel.
Yeah, just to wholly support that. We have seen some recent evidence that's coming out, particularly around long COVID, and the impact on is that age for those under 40, well, those kind of working age under 40, younger people, where we are seeing the impact. And as you said, it's absolutely life changing for some people. So yeah, just to support that.
And it's worth considering that when we have a vaccination rate in 2 doses of almost 80%, 80% of the adult population have had both doses, and they account for 50% of hospital cases in patients. So you say that may sound like a lot, but actually when you consider that 80% of the population have had both doses, and that they also tend to be, including the most vulnerable people to COVID, it shows the effectiveness of vaccination, that only 50% of those hospitalised have had both doses. So yeah, absolutely. To anybody listening out there, including press and people from the community, encourage anybody who hasn't had both of their doses of the COVID vaccine yet to go and book their appointments, or just turn up at a walk-in vaccine clinic. Okay. Any other comments or questions for Rachel on COVID? Ben?
Just quickly, do we have the data on the age profile of the hospital admissions, particularly those which are unvaccinated? And is that sort of readily shared publicly? Because I imagine that could be quite impactful for some people. And similarly with the long COVID data, who's accessing services and what's their age profile?
Yeah, so we don't routinely get the data, but staff have been brilliant and do share some of that information with us, but it isn't publicly available, partly because you have to, the interpretation of it, so where somebody's fully vaccinated, you'd have to go back and look at their records and understand how long they've been vaccinated, etc. So we do have some of that information where we were able to monitor the 50%. It's been quite, it's stayed quite level in terms of 50% being vaccinated, 50% not. You're right, in terms of those who are vaccinated, they do tend to be older, where we can look at that. So, but it isn't publicly available. We have tried to summarise that, so we do, as the hospital work closely with us on that. But there's a lot of interpretation need on it, which is why we're trying to be careful, I think.
And if I can, it's the same issue in terms of the sensitivity around the data, but with our community trust colleagues, we are recording all of the age profile of the long COVID referrals getting into the service. So again, over time, that information is available. We've just got to have it's going to take time before we can really be sure of what that's telling us, but rest assured that information is being gathered, and when it's appropriate, it will, and we're confident in it, it can and will be shared.
Yeah, I just think, from a younger person's perspective, the illness is being framed as an older person's illness, rightly or wrongly, and it's just changing that perspective, isn't it? Because I know in Staffordshire we are seeing young people come into acute care and being really, really ill. And I think it's just making sure that within those younger age groups they understand that that risk does exist.
Okay, thank you. Anything else on COVID before we move on? Can't see any other hands up, so okay. Thank you very much for your presentation and the detail, Rachel and Julie as well, for your contribution. There are no recommendations on that, so we will move on to item 14, which is board members' response to Healthwatch Spotlight report on remote appointments. Now, you may remember that this report came to the last Health and Wellbeing board, and the decision of the board was that we would ask for feedback from member organisations of the board to the recommendations that Healthwatch have made. I think we have gathered pretty much all of that, so I'll hand over to Val. She has all the detail for us.
Thanks, Chair. Yeah, it's all the feedback is detailed in that report, so I don't propose to go through them. Just want to say thank you to board members who replied. That was brilliant. We had a really good response. But I just would like to add an additional response which came after the report was published, which was from MPFT. So I'll just verbalise this very briefly. That they think they've progressed quite far with the recommendations 1 and 2 in the Healthwatch report, and have asked the Information Management and Technology Lead in MPFT to review progress on items 3 and 4. And sorry, my computer just went blank. And we'll be adding the Healthwatch guidance to Shropshire, Telford and Wrekin Care Group's website, and also reviewing with the aim of adding to remote consultation invitations. So like I said, the review's there, so thank you everyone. And if there are any other board members who've not been able to respond but would still like to do so, if you email me, I will make sure that those are passed on to Lynn at Healthwatch. Thank you.
Okay, Lynn, over to you. Do you want to respond to these responses?
Yes, I just wanted to say how useful it is for Healthwatch to hear how organisations are using a report like this, so that we can, very importantly, feed back to the members of the public and the professionals who shared their experiences with us, because it's not always clear to them the impact of their engagement with us. So this has been a really useful exercise, so thank you, Chair, for your support.
That's a pleasure. I think it has been a useful exercise all round. Are there any other comments or questions, Claire?
Thank you, Chair. It's been a really useful report and exercise for us from a CCG perspective as well. I just wanted to ask Lynn, from a Healthwatch perspective, how they'll be measuring the different organisations' changes and impacts to see whether there's any improvement in communication and understanding by the public of the sort of new ways of working.
Thank you. I think it's really important that as Healthwatch we continue to monitor the use of this sort of appointment, particularly because it is such a central part of the NHS long-term plan, particularly the use of digital first. and the conversations around that. So this is a piece of work we would plan to repeat later on to see what improvements have been made and how the approach has been personalised to meet the needs of individuals.
Thank you. We'd really welcome that.
Thank you. And can also suggest that we would welcome as a Health and Wellbeing Board to receive that update report as well. Thank you, Lynn.
Of course, that's fine.
Any other questions or comments? Can't see any other hands up or anything else, or any other hands up online or in the room. So, okay, thank you all very much. There are no formal recommendations to that report, but I've asked for it to be noted that the Health Watch follow-up report does come back to the Health and Wellbeing Board for our attention. Thank you. Okay, excellent. We will move on then to item 15, which is the Chairman's update and close. There is an item here. Reminder about ACE workshop. Apparently this is something I haven't yet responded to. So
you didn't need to read that yet.
Now, could you remind us, please?
I think everybody, again, thank you everybody, really good response. I think we've just got a couple of stragglers, or three, that we just need to, so if you haven't responded, if you could please, I'd be really grateful, because you know, or if you want to send a representative, a suitable representative from your organisation, or if you think, we'll probably have spaces, so even if you think I really would like somebody to be on that, you know, just get in touch, because we have got some additional people from other organisations coming. Thanks.
Thank you. Of course, it was always intentional that I'm just bringing up the rear to ensure that everybody else comes through the doors. But on a serious note, please do remind me about this so that I can put it in my diary. Thank you. Okay. This isn't actually any other business, but did anybody else want to flag anything up that they think that we should be talking about today? I can't see anybody indicating. Okay, before I close the meeting, just a reminder to members of the board that we will have an informal board development session for half an hour after the close of the board. I do suggest that we take a 5-minute comfort break, because we have been here for a couple of hours, but we found it very useful, I believe, to have an informal development session after the last board, so hopefully we can continue with that. Thank you all very much for your attendance, both in the room and online, and to anybody else listening in. Full credit to you for your perseverance through what are sometimes technical discussions and technical reports, but thank you all very much for your time today, and we'll see you at the December meeting.
I don't know, 7 p.m.